Welcome to Quality of Life Radio, hosted by Lisa and Nancy, editors of BigBlendMagazine.com.
Well, those fall and winter holidays are upon us, and that means we've got to look at what are we eating over the holiday season, what are we doing in our habits that may not be the best thing for us. I know we get to be naughty. I know Dr. Jackie-Eubany allows us to be naughty for a little bit, but not all the time. Very excited to have Dr. Jackie-Eubany back on Big Blend Radio's Quality of Life show today to talk about health during the holiday season, but especially this year because of the COVID-19 pandemic. Dr. Jackie is a board-certified cardiologist, an electrophysiologist that I can still say, and is the author of the best-selling book, Women and Heart Disease, The Real Story. You can get that on Amazon. You can get it on her website. Go to womenandheartdiseasebook.com. And Dr. Jackie is also based in Southern California. You can visit her at the Cardiovascular Wellness Institute of Orange County. It's in Orange County, or Orange, California, and also in Irvine, California. So more for that, go to cvwellnessinstitute.com. And, of course, you've heard Dr. Jackie on our shows for years. Her articles are also up on Blend Radio and TV.com and in Big Blend Radio and TV magazine. So check her out there. But welcome back, Dr. Jackie. Ho, ho, ho. How are you?
Good. Thanks for having me. I'm always excited to be on this show with you guys.
Oh, we're always loving having you on. And the exciting thing is last year around the holiday season, we do this every year. It's one of the most important things that we do is talk about health during the holiday season, especially for your heart. Last year, you said we can only have 4 ounces of wine a day, and this year we get to have 5. That's the most important thing.
That's right. At least 5 ounce a day. Yes.
That's good. Okay, but we're naughty, and this year it's so different talking about heart-healthy holidays. And I wonder, how dangerous is it this year? Because I feel like a lot of us have been baking and cooking, which, the cooking thing might actually be better, that maybe we're not doing as much fast food. But this year, are we getting in trouble with all the baking? And then now we're rolling into, literally could be rolling into holiday season and doing more?
Yeah. I mean, this year the holidays are just a little bit different. Again, not just with food, but with the pandemic going on. It's going to make for a very tough and difficult holiday season. But yeah, being at home and cooking and eating constantly with being quarantined, and people talk about gaining weight, quarantine 15. That all contributes to just a difficult holiday season for most people.
Do you think people are going to eat more out of being nervous about this whole pandemic thing, and also because now you're sitting at home, whereas normally you'd be driving to work then going to work, and now you're just kind of
sitting at home, right?
The refrigerator's right there all the time.
Yeah, so like most people, when I'm under a lot of stress, I eat a lot. So I can imagine people are going through periods where they're just stress eating or stress drinking. Being at home is not as fun as we all thought. When we all had to go to work, every day and long hours, we used to just pray for having a day off or 2 days off where we could, just do nothing. But this 1 or 2 days off has turned into almost 1 year of being at home, and it's just and it's just been a lot more difficult than one expected. Being stressed out over whether or not you're going to have a job, being stressed out over this illness and family members and all the additional stressors of this year just makes it a good environment for you to eat and stress out and drink, and that could be detrimental to the heart.
What can we do in regards to this stress? Because I've heard reports that suicide's actually been up this year because of the economic stress. I know that we've had I think the whole country's been under stress anyway, just with all the political drama, social, unrest. And, there's all reasons for all of that, and that's not what we're here to talk about. But the part is, what can we do to calm down and get along maybe? I mean, just even get along with ourselves in our own home. Just the anger, and I don't think that's going to, if we're going to have that many suicides on top of the other deaths that are happening, I don't think that's a good thing. I think we should somehow toe back, because that's going more than, having a few more glasses of wine and, that extra thing of, fudge brownie chocolate chip double dipped ice cream that's in there.
Sounds good to me.
I know. As I started to say that, I just started adding the ingredients in there. But just keep roll that fudge in. But there is a true seriousness about suicide, and the holidays have always been rough. Can doing techniques like meditation and things like that actually help to kind of stymie that a little bit, or getting help, doing something so that we don't end up there? Because I feel like the stress can end that way, in a very sad, negative space there. But also, eventually, couldn't it just, if you have feeling that tense that much, can that affect your heart too?
Yeah, absolutely. Like we've all been saying, this year has just been really stressful with the economy, people not being able to pay their rent, not being able to provide for their children, and then having their children at home from school and homeschooling and everything. So it's just been extremely stressful. And, of course, when people get stressed out, they then engage in non-healthy behavior, more likely to eat, not care about eating healthy, not care about, just maintaining, one glass of wine a day. And it can be very difficult. And definitely meditation will help, because that's one of the techniques that I use to relax and calm myself down. But I think everyone needs to figure out what their happy place is, what they can do to bring, calm themselves down, or to just, go back into yourself and just be calmer, whether that be taking a walk. I know we can't go to the gym anymore because the gyms are closed, but, whether it be taking a walk or just carving out 20 minutes out of the day for yourself to do something that makes you happy, whether it's just polishing your nails or just reading a book or something. But you have to create time for yourself so that you can de-stress, because, having a lot of stress, being at home, and everything that's been going on this year can really contribute to poor heart health and depression and some of the things we're seeing, like suicide rates going up.
That 20 minutes, I think, is really attainable, and I love that you brought that up, because when you think about 20 minutes, that's a doable thing. And even if you say, okay, hey, honey, take the kids for 20 minutes, it's not like take them for the day. I need to run out, do your own thing. Maybe it's going to the garden. I don't know, whatever it is. But whatever that's attainable. Exactly. It could just be, I'm watching TV for 20 minutes. Leave me alone.
Exactly.
Exactly. Whatever you need to do. Exactly. And I think it's hard, like you're saying, families are living together. We saw this in 2008 when families started moving in together. You're seeing a lot more RVs and driveways right now. And, well, whatever you got to do, you got to do to get through.
Yeah,
and it's okay to, I think, in a way, too, we're getting more acceptant, about things this year. We're kind of learning to lean over a little bit more. As much as there's been political fighting, we're also helping each other more,
Right. Exactly. So exactly. We're learning what's important, to us, because now that, most of the things that we do every day have been stripped away from us. Now we're having to live with ourselves and learn, more about ourselves and what's really important in life, as opposed to all the superficial things that we do all the time.
I think what makes it so hard is, in a sense, it's invisible. It's not like a whole bunch of people running over the hill with guns and spears and throwing things at you. And attacking you. This is something invisible that you can't see, and somebody's next to you and coughs. It's like, oh, take him to the gallows. You know what I mean? I feel like somebody could write a really good movie, in the screenplay about this, where it could end up where if you even look like you're going to sneeze, you're going to jail. Just
right.
Yeah, that sounds really bad, but I just feel like we're on that edge of. There's two factions. Let's ignore it all. It doesn't exist, and the other side that is like anxious about everything. And somewhere in the middle has to be a solid, sensible grounding of, don't be scared of everything, but absolutely take precautions. And that's where I see people kind of going back and forth. And then you throw the holidays in, where everybody's supposed to fly everywhere and get together, and all of a sudden, maybe you can or cannot do that, don't want to do it, scared to do it, feel guilty if you don't. It really is a mixed bag this time.
Yes, it really is. I would have to agree with you. I like that, the invisible terrorist. So we're being attacked by an invisible terrorist, which is actually pretty scary because you don't see it. You watch TV and you hear all these scary stories about people dying. I mean, I think the death rate is now up to 240,000 people in the United States. So it's just, it's you can't help but know that it's there because of your life, because your life has changed. You're not going anywhere. You're either working from home, your kids are at home. I mean, your whole life has changed. So there is a sense that there's something going on that has really caused a drastic change in your lifestyle, but you may not necessarily be able to see it. So that can cause an additional stress.
It's like your children come and be like, "Who did you touch today? Did somebody touch you?" No, I know. Like, did you pick up toys? Well, it's like,
I've got a solution for this year's holiday season. I think that everybody should have the ugly mask, the ugly Christmas mask. We have the ugly sweater. We need the ugly mask because then everyone can get in, whether you believe it or not, get into it because. I
think that's Halloween.
Come on. Well, come on, you can deck your mask. You can hang things on it. You can make a whole headdress from it that goes like, I'm sorry, you could like I feel like
kids, they're looking at all these adults in ugly masks.
Zorro,
and it would make for interesting conversation. Everybody will have something to talk to, and they'll take their mind off, life for 15 minutes as they're laughing at these ugly masks.
Hey, listen, Portofino, check it out. We love our wine in our bags, our Portofino bags, right? Dr. Jackie, they now made it that not only can you pour wine out of the bags, they have a dual thing. So the other thing has hand sanitizer coming out, and they give you a scarf and a mask to match your bag.
Really?
See?
Really?
This is like, I'm just saying, entrepreneurs, get on it. Like that.
Yeah,
exactly. You could be stylish with it. They don't have ugly sweater stuff because they got style. But I think the ugly sweater thing's funny. What if we could hang things on our mask? That would be even funnier, like have a branch.
That would be funny.
We can't get too close because of the 6 feet. But Dr. Jackie, with this too, all right, we want to watch the cookies, and I think they're saying now that have a Zoom Thanksgiving instead of an ICU Christmas. And
good heavens, I know.
Right, but there's a point to it, right? It's like don't be around too many people, and, just because it's Uncle Joe may have met the wrong Aunt Sally. You know what I mean?
Are you talking about the funny uncle we all have?
Everybody has an Uncle Joe.
Everybody has one of those, yes, exactly.
I know. Please, I'm never going to marry him, I swear. But
I know.
Okay.
So go ahead.
No, you go ahead. You're the doctor.
No, I mean, you're absolutely correct. I mean, we're seeing the numbers rising dramatically over the past few weeks. The death rates lagging a sort of, sort of lagging behind, but we're just seeing dramatic increase in numbers of COVID cases, and we suspect that, it's from gatherings. Now that we're in the winter period and, you can't go outside anymore, people are doing more indoor gatherings, and that is most likely contributing to the spread of the virus. And now it's become more concerning now that we're coming to the holiday period where people like to gather together with family members. So it's going to be tough, with such high numbers of COVID out there. The chances that you're going to run into someone or have a family member with it goes up. So it's just very important to be cognizant of that during the holidays, especially with Thanksgiving coming up, and that, you should try to limit your family gatherings. I think the CDC recommends less than 10 people together, and then maybe do a Zoom and, Zoom party so that you can see all your other family members. But make sure while you guys are together, try to wear your mask as much as possible. Avoid lots of alcohol, because it's when you start drinking is when you lose your inhibition and you're no longer following CDC guidelines. So limiting the alcohol that family members are drinking, along with all of the other heart healthy things.
Yeah, Dr. Jackie, you got the two cousins that are going to be all like, "I love you, man." You can't be having that on New Year's. You want to, think about New Year's, like everybody out there, kissing each other and carrying on, and the mistletoe thing, all of that on Christmas, So it's like, Shanae, it's not happening. It's not allowed. It's not allowed.
Right, exactly.
Get the ruler out.
I mean,
walk around with a ruler. That's what our mask should have, as a ruler. A school ruler with 6 feet on it. That's it. And our Christmas sweaters could have it. But, behave with that. Speaking about not getting COVID over the holidays, I wanted to touch on this because I know COVID has become almost a very political thing. It's like, you're this if you believe this, you're wearing a mask. If you believe that, it's getting a little silly for me personally. I'm just like, I don't want to get sick. I sure as heck don't want my mom to get sick, and I don't want anybody that's in our pathway as we travel to get sick. No one should get sick. We've heard cases come back where some people, it's like the flu, they're fine, and it kind of goes on their immune system, and then some people, is it true that they're coming, like they'll get through it, they're fine, but find out that there's heart damage from COVID?
Yeah, we're learning actually that there can be some long-term heart damage in patients who've had COVID infection. I know there's this one study that showed that a quarter of the people who were hospitalized with COVID were diagnosed with some kind of heart complication. And then even those that don't have heart complication can end up having long-term sequelae or complications from heart disease like heart failure. There was a study looking at, people who'd had COVID, because COVID causes an inflammation of the muscles of the heart. So when you go through that inflammation, and once you get over COVID, that the tissue may not heal 100%. There may be some scarring there. And this can eventually lead to heart failure down the line. There was some study published recently that showed that they were looking at the hearts of people who've had COVID, and they found that some of them still have some abnormalities, whether it be microscopic abnormalities in their heart. And what that means, we don't know for sure yet. But it seems like there is long-term effects of COVID on the heart. But with time, we will find out what these long-term effects are going to be.
Wow.
It's interesting because I know in centuries ago, different countries went through things like typhoid and yellow fever and bubonic plague and all these kinds of plagues that have happened, and without the internet, for one, and without the medical the medical expertise we have today. So it's kind of interesting, when you think of it on that level of how many more people are in the world, how and what access do they have for information and medicine and all that kind of thing. But there's this, I don't know, I think maybe before, if your doctor said do this, people went, yeah, let's do that. But today it's open for debate, which is interesting because it has become political, which is really interesting. And I don't know enough about history to know if diseases like this became political. You never read that in history books.
No.
About, if like yellow fever became or typhoid became political. But this seems to be different now.
Yeah.
And I think Go ahead.
Go ahead. I'm sorry.
No,
I'm sorry.
I'm wondering about it. That's all.
Yeah. No, I don't think it was political back then, because you had these illnesses that came and decimated so many people that, everyone could see. People probably had family members with it, and they could see the devastation to the point where when a vaccine became available, everybody was jumping up and down to take the vaccine because, stuff like polio, when polio caused, paralysis and you being in a wheelchair, FDR had polio and he was in a wheelchair. So everybody could see this. And it's like it's nothing that they wanted to have. So when the vaccine probably became available, I'm sure people went and, got in line to get the vaccine, because when you see the long-term damage of this illness, you don't want to have it. You just don't. So
I think the issue is people are worried about the economics versus the death. It's like a fight over, are you going to die from a disease or die from starvation? That's kind of where the polar opposites are. And I understand that. I mean, people do have to get along, but you can be smart with your mask. You can do it's not like we're the boy in the bubble, So I think it's a little bit different, and we're learning more things.
I'd like to be in a bubble.
Yeah.
I think it'd be fun.
But can't we also, Dr. Jackie, I think it's different if you have diabetes and if you do have heart disease, right? And if you already have a condition, then you're a little bit, you've got to watch it if you have asthma and things like that. But and age, right? But can't we help our bodies be stronger so that if we do get it, it's not as bad?
Well, we don't have a lot of evidence what do you mean, like by taking medications or anything like that?
No, can we help our immune systems and boost up our bodies? So, like, in other words, like you say, don't go over your 5 ounces of wine at night.
Yeah, right.
If you do, you're weakening your immune system, you're weakening your heart. So therefore, COVID will come knocking on your door sooner. You know what I mean? Well, it could. Let's put it that way. I don't want to be the Grim Reaper here, but you know what I mean? So the healthier we are, the stronger we are if we get it, because anyone can get it.
Absolutely.
But we're stronger to fight it.
Yeah, the healthier you are, the less likely you are to die. I mean, die from it, which is what this is what we're learning now, especially when we see in younger people. Younger people tend to have a more benign course of the disease. So, the healthier you are, the more likely you are to survive it and just have mild symptoms. Of course, healthy means you don't have any of the, risk factors. And a lot of risk factors have to do with, heart and lung issues, like hypertension, obesity, if you're a heavy smoker, if you have lung issues, if you don't, if you don't exercise very much, just, if you're elderly. So all these factors puts you at high risk for dying from this disease. So that's what makes it really bad. So that's why we wear masks. We wear masks not for us because, so some of us are young and healthy. So it's not for us because we know that if we get the illness, it probably won't be a major illness. But we do it for our family members. We do it for our elderly mothers. We do it for our sick, family members. We wear masks so that we don't bring stuff to them because they're the ones who are extra vulnerable to this illness. So you should be really cognizant, not just about you and the fact that I'm young, I'm healthy. If I get this, I'm just going to have the sniffles and I'll be fine. But think about your family members. Think about your friends around you that are not so fortunate to be as healthy as you are. If they get this illness, this could really be a life sentence for them. So just be, just be respectful of other people and of other people's well-being.
It's interesting as we travel that we'll go in and out of different towns, and you'll see in and out of different towns different reactions where unless the store says you shall wear a mask or you can't come in, you will find, like in some towns, nobody's wearing masks ever. And other towns, pretty much everybody's wearing masks. So it's kind of an interesting thing as we travel. We wear masks, whether or not somebody tells us to. But when a store stands up and says you can't come in without a mask, that is a real change maker when the store stands up. You know,
no, I mean, I completely agree.
Yeah, more of them need to stand up.
Yeah, no, I completely agree. It's just because we just don't have leadership from the top. You know, this is I feel like this is a national issue, and there should have been national standards, but, you know, it was just left up to each state to decide how they were going to deal with this. And the problem with COVID is not bound by borders of states. You know, if one state has a mask mandate and the state next door doesn't have a mask mandate, people cross back and forth. You can't get a virus under control when people are doing different things. And that's a big issue. You know, this disease first started out on the coast. And then, you know, New York had it worse. You know, California had, you know, bad cases. But the Midwest, for the most part, didn't have anything. But now, Midwest is who's suffering the most. You know,
okay, wait, Nancy, detour. That's what keeps happening to us. It's like I can tell you what's going on with the country because we keep having to turn around. And it's like we're not bringing it. We're so careful. Oh, my God. You know, it's like you want to support restaurants, but you really can only do it in a limited fashion. And, you know, it's like if you travel like we do, we eat in a park. We have so many disinfectants. My hands curl up when they see them. You know, I'm just don't rub your eyes after cleaning your hands on those. By the way, don't touch your nose. Don't do it. But it's better than getting COVID. And it is hard about the border things, and they do a good job of keeping up. It's like watching the elections, who's winning. They do a good job of, you know, what's going on in the States online. I think they're trying really hard to keep it as real time as possible. But, you know, I always wonder, like, okay, you know, if you go to this state, you have to be quarantined. Like, who's going to enforce that? Like, really? Like,
there is no enforcement of anything.
You know?
No.
You know?
What happens with all the criminals, like, running around with, you know, anyway, let's not. It's holiday season. It's holiday season. We don't want to talk about that.
Yes.
But we have talked about stress, and that's something we always talk about in regards to the holiday season because normally we're freaking out over the turkey or did this souffle work. And I think now, I don't know, maybe we've got more cooking practice in this year. Now it's going to be like, do we know how to make Zoom work without an echo?
It will be a different holiday season this year.
I personally think different is good. I'm just that way. I think we all need a little difference and to get creative with things. I feel bad, though, for the families that can't get together, and sometimes that's the last time you're going to see each other. That's the hard thing.
Yeah,
that's been the hard thing this year. You know, we've got some friends who've lost their parents, their moms, and they weren't able to say goodbye. And I think that's hard. And I think that's going to be the hard thing. Yeah. But at the same time, you don't, that spreading of it, you know. So I think that's the hard part. But on the positive side, we can still stay active, take walks around the block, stay 6 feet away, go to our parks. Do you think the vaccine's going to really happen? Do you feel any hope?
So. I think so. I think that we have good data now from two different companies, Pfizer and Moderna, have vaccines that are over 90% effective. So they're going to apply for emergency use in the next few days, and they expect to start rolling this out by mid to late December, rolling it out probably to healthcare workers first and high-risk patients. And at some point next summer, I think it'll be available to everybody. The data looks good so far, but we still haven't seen it all, but it definitely looks good so far. I know that Fauci is excited about the data. So I think that there's a light at the end of the tunnel, but it's going to get worse before it gets better because the numbers are just really high right now. And since everyone's not going to get the vaccine at one time, we still are going to have to practice these CDC guidelines of social distancing, wearing a mask, making sure you wash your hands, avoiding large crowds, and those kinds of things. We still are going to be doing this for a long period of time while we're waiting for people to get vaccinated, waiting for herd immunity. So that, along with those people who already have it, we hope that, we get this herd immunity plus the vaccination, that we may be able to eradicate this. But it's going to take some time, maybe at the end of the next year. So in the interim, we're still going to be living the way that we're living now, and just being exceptionally cautious. But it's a light at the end of the tunnel. Who would have guessed that we would have had a vaccine this quickly? It takes on average 4 to 5 years to get a vaccination. So this is amazing, and I think this is good news. And I think we just have to hang in there for just a little longer.
Do you do that with your morning coffee? Look at what's going on in medicine, like what's popped up. Like, I wouldn't know how to read that. Other people are reading stocks, and I'm looking at going, okay, what are the Twitter trends? You guys are all like, hey, there's this gene going out of line over here.
Sometimes what? I have sometimes I get alerts for anything new coming on in medicine, especially with the vaccines and stuff. We all get alerts when there's new data out there, especially about COVID. Now we have it set on our phone, and we get the beep when there's something new. And so that's how I keep up with that. Wow,
it's just a new world, and hey, we just keep moving forward and do it as healthy and as happily as possible and as stress-free as possible. We got to all take a walk in the woods and hang out with the wild turkeys. That's what I'm saying, because there's wild turkeys out here and deer where we are in Pennsylvania.
They're so cool.
Yes, we have deer, and then I think when this is airing, we'll still be in Pennsylvania. That's right, and then we'll be in Florida playing with more turkeys. There's turkeys there, too, not the ones in pans and not, the turkey kind of people, but the actual wild turkeys, the cool ones. But Dr. Jackie, always great to chat with you. I know you're working hard on your next book all about the Mediterranean diet. Now, is that something that can help our immune system, especially when we look at COVID and all these things, and the flu season? Is it good to eat a Mediterranean diet?
Yes, absolutely. And there's been studies on this Mediterranean diet. Most recently, the PreviMed study that was published in the New England Journal of Medicine, that does show that this diet can decrease your risk of heart disease by up to 30%. So if it can lower your heart disease risk, it makes you less likely to die from COVID. I'm really excited.
I thought of you because we made salad with feta cheese today, and we thought we're allowed to have feta cheese. And then I saw how much I put on, and I thought probably not that much.
Exactly.
Everything
has to be in moderation. Everything has to be in moderation. But so my book's coming out, and maybe one day we'll get together on the radio. We'll talk about some of the tenets of the Mediterranean diet and what makes it so much healthier than regular eating habits.
You're allowed wine.
Yes. You are allowed wine, which most people like. It's actually the diet is very similar to a plant-based diet, but it does allow you to eat some meat and some meat and some chicken, but not as often. So for those of you who just just can't do plant-based because you absolutely love your meat, then this diet does allow you to eat some meat, but it limits the amount that you can eat. And I think a limited amount is better than just no meat at all.
See, this is good for me because I'm not big on meat, but I know sometimes my body's like, you got to eat it. Nancy's always like, you need to eat some,
No, I think we're omnivores as a human species. We're meant to eat a lot of different things in moderation, all of them. And I really, we've done the vegan thing and we've done the vegetarian thing, and the results weren't all that great. So I like a mostly plant-based diet with a little bit of protein meat in there. And I'm not a fan of let's just eat soybeans.
No. Well, I think the thing is, like, I think you can do a lot if you're a vegan, but you have to really be focused on it, and you have
really
to be able to
need to know what
do
you're
it
doing.
as a whole foods thing than these prepackaged things that aren't necessarily always good for you, because that's where I got sick.
Right.
And then I found out I'm getting now, I have a sensitivity/allergy to tree nuts. And so that ruins like a whole bunch. That just, in a word, sucks. Not being able to have cashews and almonds.
But that's only in
pecans.
this country.
Yeah, it sucks. So it's like there went my veganism out the window, and we're allergic to fish. So
you love the veganism. That sounds weird.
I did. But the B vitamins, Nancy kept saying to me, you're going to have to eat meat to get Bs.
Yeah.
You need to. That's it. And so I do. As we travel, it happens on its own, and so that's when I eat it. It's like, hello, they're giving me bacon for breakfast. I'll take it. Uh-oh, Dr. Jackie's on the phone.
I mean, you don't have to be saying bacon.
Broiled
chicken
it could
be
breast.
Turkey bacon. Yeah, turkey bacon, something with less saturated
You know what?
fat.
Most
or maybe just
bed and breakfasts that
fat.
we travel to are using turkey or chicken sausage.
Yeah.
Majority of them. Because
that's good.
Majority it's turkey or chicken. I never thought of chicken. But everywhere we're going, it's like, this is chicken bread, like chicken sausage. I'm like, what do you mean? What? But if that's everywhere we've gone, they've done that. Also because of those of Jewish faith, no pork, that kind of thing.
No pork,
so
exactly.
Yeah, and it's good. It's got that little salt factor that Dr. Jackie doesn't want us to have either. Well, Dr. Jackie, happy holidays to you. I know you're going to be on our holiday parties coming up, so everyone stay tuned for that. But enjoy your Thanksgiving. Be safe, be happy, be healthy. And we'll talk to you again soon.
Thank you. Yes, you guys too. Happy holidays, and we will see you at the next virtual party.
That's right. That's right. Everybody, again, keep up with Dr. Jacqueline-Eubany. She's the author of Women and Heart Disease, The Real Story, and it is a bestseller. So go get it. Don't be the last one on the block. Go get it. It's on Amazon. Also go to womenandheartdiseasebook.com. Thanks so much, Dr. Jackie. We'll talk with you soon.
Thank you. Have a wonderful day.
You too.